Hey, good afternoon, everyone. We will start with the financials portion of our mid-year training this afternoon. Thanks to everyone for being here. This recording will be on the website, as well as all of the other training sessions will be recorded and placed on the website if you want to refer back to them. If there's somebody who couldn't make these training sessions today and you'd like to go back and watch all or just a portion of these trainings. And today we have with us from PCG, John Ward, Rose Jensen, Matt Gillis, and Jennifer Pham. We also have from the Colorado Department of Education, Omar Estrada, and from the department today we have Olga Ginshin, myself, and Tracy Gonzalez. Thanks to all the school districts and BOCES and community partners that we have here today with us. I appreciate all of your participation from across the state. And with that, I will hand it over to Jen, who will go over the annual portion of cost reporting. Thank you, Jen.
Thanks, Olga. Thanks, everyone, again for coming to this session. I'll be covering the annual cost reporting section and then moving on to Matt to cover the Medicaid administrative claiming. So for today's agenda, we'll just go through a brief introduction again. I'll go ahead and talk about the annual reimbursement side of the program along with free care. And then we'll transition into that Medicaid administrative claiming portion and then wrap up with some program contacts. So like all of the presentations, we've included here a list of acronyms, so feel free to use these as needed. And then if you've been participating in the other sessions, we've included just a brief introduction throughout. So I'll touch on this briefly, and then if you have any questions, feel free. But at the federal government level, we have the Centers for Medicare and Medicaid Services, or CMS, that offers that overall program guidance. We have IDEA, which is the Individuals with Disabilities Education Act that requires districts to provide students with disabilities a free appropriate public education, or FAPE. And then the federal law also states that the Medicaid agencies are responsible to pay for those direct services identified on a student's medical plan of care, as well as those administrative costs in support of that Medicaid state plan, or SPA. And then at the state government level, we have the department, so the Colorado Department of Healthcare Policy and Financing, that administers the school-based claiming program. The state agencies also work under those CMS laws and guidelines and provides oversight of the vendor's administration of the program. So Public Consulting Group, or PCG, is the vendor for the state. And then the state also issues those reimbursements to districts. At the district level, you'll initially sign that intergovernmental participation agreement with the department to participate in the school-based claiming program. And then funds are ultimately recovered for those services provided to Medicaid enrolled students. We further have broken up the entities into their respective roles and responsibilities. So at the department, we have here the program policy experts, like I mentioned. They enforce those CMS guidelines, provide coordinating trainings such as today's, and then approve or deny that random moment time study, as well as any of those cost reporting extension requests. And then over at the PCG side, they are the administrators of the PCG claiming system. They provide subject experts in the random moment time study, quarterly cost reporting, annual cost reporting, as well as provides the admin for the help desk. So really that platform that you'll submit any of your inquiries to. At the CDE, or Colorado Department of Education side, we have Omar, so you'll go to him with any reimbursement spending questions, as well as those annual CDE reimbursement spending reports. And then over here, we have our stakeholders, which are our experienced regional coordinators. They have enhanced areas of knowledge in different program components, whether that be random moment time study, cost reporting, transportation, any of those items. And then they also speak on behalf of district regions in these stakeholder meetings. So really gathering your feedback about what's going well in the program, what can we improve upon, and sharing best practices with the greater group. And then now we'll discuss a little bit about annual reimbursement for the program. So here we've included the annual cost reporting trend. So this is showing the statewide total reimbursement for fiscal years 2019 through 2020, as well as fiscal year 2020 through 21. So you can see here direct service reimbursement is represented in that dark blue color. Transportation is represented in the light blue. And then we have that yellow representing free care. And at first glance, you may not notice that FY 2019 through 2020 does not include any free care. And that was because free care did not take into effect until FY 2020-21. So that's why you don't see that free care there. But when we do look at direct service reimbursement for FY 2019 through 2020, we do see that statewide total reimbursement at about 51 million. And then we see that transportation total reimbursement at about a little bit less than 4 million, all totaling 55 million. When you take a look at FY 2020 through 21, you see these numbers slightly drop. So that 51 million for direct service slightly drops to the 46.5 million. Transportation also sees that slight decrease from the 3.7 million to the 3.3 million. But then we do have that free care reimbursement added, which added about almost 3 million to statewide total reimbursement. So all of that equaling 52.5 million. I want to know if anyone has an idea of why we see the decrease between the two fiscal years. Let's see, we have some questions on the chat. So Tammy mentioned, do you believe the amount was down in 2021 due to the pandemic? And then Marley mentioned free care really cushioned the drop from the remote learning's impact on direct service. So you're both correct on that. We do see these slight numbers decrease from the two fiscal years due to that COVID-19 pandemic, really impacting the delivery of direct services while students were transitioning from in-person learning to remote learning. And then transportation being one of the hardest hit areas. So literally fewer students were being transported to schools to receive those direct services. And I also wanted to mention that if we do take it back another fiscal year into FY 2018-2019, the number for the statewide reimbursement was slightly lower than the 55 million, but that was due to not having free care at that time. So really, as Marley mentioned, that free care really did cushion that drop. And then also, someone go off of mute. Okay. I also wanted to note that fiscal year 2021-22's numbers are preliminary at this time, but they are expected to increase for total reimbursement. So we're hoping to share that with you all in a future training. But any questions so far about these two fiscal years in particular? Perfect. And then here we have our annual certified public expenditure CPE calculation. We have up top here, you see the direct service calculation, and then the bottom portion is representing free care. Out of curiosity, you can use the little button to raise your hand or type in the chat or go off mute, but who here participates in free care? I see a couple hands. I'll wait just a minute. So actually, this is a trick question. Everyone participates in free care. So really, if you participate in direct service, you're automatically participating in free care. So you can notice that both direct service and free care do start off with that same cost base. So your net reported salaries, benefits, contracted costs, as well as those direct medical other costs. We add in the unrestricted indirect cost rate. So this is district specific. That number comes from CDE. And you can think about these costs as your program operating or overhead expenses. When we take a look at direct service, we apply the time study IEP direct medical percentage. So we're really focusing on participants answering the time study on whether they're working on that IEP or an IFSP, as well as their specific moment responses. We then apply the IEP ratio. So you can think about this as your December 1st count. This is also populated by PCG, and you'll get your direct medical allowable costs here. If your district does report any type of transportation, you'll go ahead and add all of those transportation allowable costs here as well. When we look at free care, like I mentioned, we start off with that same cost base. So all of your net reported salaries, benefits, contracted costs, as well as those direct medical other costs. We still add in that unrestricted indirect cost rate, which is that boost to your calculation. And then instead of applying that time study IEP direct medical percentage, we go ahead and apply the time study free care direct medical percentage. So this is also a statewide average, really honing in on what participants are answering in their moments. So when they're working from those other medical plans of care. And then instead of applying the IEP ratio, that free care applies the Medicaid enrollment rate. So this is your October 1st count, and then you'll get your free care allowable costs from here. Really, when you get your direct medical, along with free care, and then transportation, if your district reports transportation, you will get your total Medicaid allowable costs or total CPE from there. Any questions regarding this calculation graphic about any of the components? Great. So in terms of CPE, we wanted just to provide best practices in mind when you are signing your CPE forms. So please make sure you are identifying a backup staff member in case your primary signer is out of the office. We want to make sure that they do have access to the PCG claiming system in order to go onto the page, print off, and then upload that CPE form. And then please also make sure you are reviewing all of that cost settlement summary within the PCG claiming system and approve once you have verified all of the figures look accurate. And then lastly, don't forget to complete all fields on that bottom section of the CPE form. So that includes that date and signature from someone with that signing authority, whether that be a business manager, chief financial officer, superintendent. We want to make sure that those are signed by someone who has that authority to sign off on your funds. So any questions regarding that annual cost reporting trend, CPE form, before I move on to free care? Great. So here we have our free care reimbursement. So as a quick kind of background regarding free care, in December of 2014, CMS did reverse their decision of not allowing free care to be reimbursed. So what does this mean? This reversal means that Medicaid eligible services provided to enrolled students are available for reimbursement if all other Medicaid requirements are met. So here we have that free care was implemented on October 1st of 2020. You can see that when free care was taken into effect in the October through December of 2020 quarter, that free care percentage did start at 3.4%. It has increased every single quarter up until that October through December of 2021 quarter, at 5.3%, and then you do see that slight drop there to the 4.9%. However, we are starting to see that percentage rebound back to the 5%. So hopefully we can continue to see this as this has been really a positive impact to the program. And then along with free care, the expansion of it allowed the districts and BOCES to be reimbursed for these services prescribed and rendered on other medical plans of care if that medical necessity has been established. So we did want to provide a couple of reminders. So providers should be trained on the sources of the services they are providing to students, whether that be on like the traditional IEP or individual family services plan, as well as those standalone other medical plans of care. And then providers should also be able to answer those time study questions with specificity about the services they are rendering. So making sure their responses are detailed and really specific about what exactly they were doing at that moment of time to kind of reduce those follow-ups. And then we've also included examples of these other medical plans of care that we've seen. One, those individualized healthcare plans, whether that be asthma, allergy, meal modification. And then we also have those behavior intervention plans and 504s as well. I'm curious to see for your districts where you are at in this process, whether you're still training providers on free care, kind of taking a look at your other medical plans of care to see if they are or aren't in compliance. Where are your districts at in this process? Feel free to come off mute, type in the chat. Heidi mentioned that they are focusing on healthcare plans right now. Great. Do you see in your healthcare plans where those gaps might be, Heidi? Not to put you on the spot. Perfect. Mostly working on training the nursing staff. Marley mentioned that they are working to train their new nurses and health staff on what is required in the health plan, such as the scope, since they've had lots of turnover. Any other districts want to share where they're at in the process? Nancy mentioned that they are focusing on those healthcare plans and started with behavior plans.
Hi, Jennifer. Leticia here. For Aurora Public Schools, we are just starting to touch on the 504s. And it seems it's a huge mess there, even for the departments that are conducting 504s. So I am very happy to say that they're including us to be part of the conversation and how to improve 504 plans, including IEPs, how they're being writing the IEPs. It has been a huge deal to figure out where do we find the information that it's necessary. So right now we're in the baby steps. We're just starting to working on that. So any other district that has good ideas about how we can tackle these issues, 504s, IEPs, please, let's have a conversation. I'm interested to listen.
Thanks for sharing. I think Adeline also had kind of the same regarding the 504s, that their district has been taking a look at those healthcare plans and 504s as well. And then Marley also mentioned that they are looking at behavior plans as their next step too. So really, I feel like a lot of you are kind of in the same spot of looking at your other plans of care and what kind of is the gap in those, and kind of working with your providers on getting them in compliance. So thanks everyone for sharing. And then in terms of those IEPs, as well as other medical plans of care, we've included these 3 items that are relevant to all the medical plans of care. So all of them do need to establish that medical necessity by a qualified medical professional practicing within his or her scope. The plan of care also has to include, like Marley mentioned, that scope, duration, and frequency. So really what we're talking about in terms of scope are exactly the types of services, whether that be physical therapy, speech, nursing, and then duration and frequency. So for which the service will be delivered, including how often, the length of each session, and then the length of the plan. And then the last item that has to be included is that providers log in their services upon delivery. So really, once the service is delivered to the student that is prescribed on their plan of care, the service is logged by that provider, and then that documentation is kept. So really, any questions regarding these 3 items, or kind of any other medical plans of care? Well, perfect. I will pass it on to Matt, and he'll go into the Medicaid administrative claiming section.
Awesome. Thank you, Jen. And like Jen said, we're going to transition from the annual cost reports and free care into Medicaid administrative claiming, which is the MAC portion of the program, and is going to be your quarterly cost reporting. So we'll take a look at the allowable MAC activities and just go through what some of the items that are reimbursable through this portion of the program. Just a nice list for everyone to keep by their side when they're doing staff pool lists, whether entering new people or going through and updating and making sure that staff pool list member is still doing these activities. These are going to be the items that are reimbursable through the MAC program. So having this by your side is always very helpful. Pretty clearly laid out, just some things to keep in mind. Figured I'd ask if there's any questions on these instead of reading off all 6 of them. If there's any questions on any ones in particular, and if not, we'll just keep moving on. But like I said, just something good to have by your side, whether you're a new coordinator or someone that's looking to just refresh and take a look at their staff pool list to make sure these activities are what those people are doing. But anyways, something that you all just finished up, and thank you everyone for submitting and certifying your October, December quarterly costs, is entering these costs. In case you aren't aware, there are a couple of options to be able to upload those costs for the quarter. You can do them individually by selecting each participant within the PCG claiming system and typing those costs in. While this may seem tedious for you larger districts, we do see that smaller districts or districts with a smaller number of participants prefer to do it this way, as well as new coordinators. We feel that just seeing the layout of costs, the method on the claiming system shows you the calculations. So doing these a couple times if you're a new coordinator or new in a role in general may be helpful for that individual method. But we always have the import-export method as well. So within our PCG claiming system, you are able to export all members that were on your staff pool list for the quarter through an Excel spreadsheet in that quarterly cost section. Be able to enter those salaries, benefits, and contracted staff costs, and then re-upload that item to the PCG claiming system. This is just one way to get those all up there. One large batch, especially for you districts with a large number of participants. And then also for some of the steps I'll talk about next is it's good to have that Excel spreadsheet off to the side, be able to reference possibly later on or pass on to other members of your staff. But even though you all finish this up, we can switch over to some quarterly cost reporting reminders in case you all need some tips or anything if you weren't necessarily involved in the process as much this time around. So we listed off just a couple of phases that you'll go through when reporting those costs and some items to keep in mind when doing them. So what you all just finished doing is gathering those financial reports for the quarter in question, so October to December. And just a reminder for the MAC program and your quarterly cost reports, you're going to use the cash basis accounting method. So you're going to be making sure that you tie those costs back to date of payment. We don't look at date of service for your quarterly cost report, but your annual will be accrual basis. So you just want to make sure that differentiation is there when entering costs. So making sure that you use cash basis accounting when entering them. While you're entering them, you may trigger warnings. Our warnings are double checking costs for any errors, things that fall outside of the thresholds that we calculate every quarter for you, which I'll get into on the next slide. But we want to make sure that you do resolve those warnings. We'll go through some ways to do that later on as well. But another thing to keep in mind with that is making note of individuals who have zero costs reported or 100% federally funded. When those warnings get triggered, then you'll certify. You'll have hopefully someone else review or just do a second look over prior to hitting that certify button. It will now ask you to take a look again at all those warnings that were triggered, make sure they were properly resolved, those values were entered correctly. Then you can click certify. But we think that it's important to pull those zero costs and 100% federally funded methods, because if you're in the situation where you're not the person doing financials and the staff pool list, making note of those people who had zero costs for the quarter or were 100% federally funded is important for a staff pool list member to note. That may mean that they aren't working there anymore, or the funding, if they're 100% federally funded, it doesn't make sense for them to still be on the staff pool list because they don't receive any reimbursement if they're funded fully through federal funds. So just making sure that you're not operating in a silo. If you are only doing financials, that information is going to be helpful for your staff pool list members. And after you certify, you are able to reach out to us if you notice any errors in your costs that you reported. Depending on the phase that we are in with claims, we'll either be able to reopen them or file an amendment for correction of over reporting on those costs, but also communicate with PCG after you have certified those costs if there are any errors that you need to change. And like I said, you'll trigger those warnings, and a way that we calculate those warnings is through thresholds. So these thresholds are calculated on an annual basis for your specific districts, for the cost pools that you participate in, and then even down to job category. So we take all of your district's submitted information for the previous fiscal year, compile that up, add in standards for inflation. So we'll sometimes use quality of life increase, consumer price indexes, but we want to try and map and match the inflation that's going on with your salaries to hopefully keep in line with raises and other items that your district may be going through. But we do calculate these on an annual basis for your district specific costs. So hopefully it doesn't seem like you're hitting too many warnings, but that is how we do go through that process and try and keep it as up to date for you as we can. Then if you do happen to trigger some of those warnings, just the icons at the bottom of the screen are what you'll be looking out for to know if you had no warnings, the just yellow triangle will be a normal warning and the orange triangle will be severe warnings. Just when you're scrolling through, if you're not familiar with what the warnings are, how they get triggered, that's what they are. Nothing negative, just to go back, look again, and make sure they're all right. And when you're taking care of those warnings, we have a couple of do's and don'ts that we wanted to list out just to keep in mind when resolving these warnings that were triggered. So we do have pre-populated drop-down menus for you all to be able to do to resolve these warnings. They're pre-selected, they're approved responses to be able to resolve those warnings. So use those drop-down menus or drop-down boxes from the menu that we have to make sure that those get resolved. If you do have anything to note for us, feel free to throw them in the notes section, but don't use them instead of the drop-down boxes. We do need those drop-down boxes to be pre-selected, or you cannot certify for the quarter. And then if you do have, again, a larger district or a large number of warnings that were triggered, you can use the same import export feature you use to put costs into the claiming system to be able to resolve those warnings and edit them quicker. So just another way to speed up that process and hopefully take less time. And then one other thing that will take less time is if you do select the drop-down box, please make sure it's for the triggered warning that is related to that individual. Selecting a drop-down box that doesn't tie back to the reason for the warning means just that we have to reach out to you, get confirmation, and get that changed in the system to resolve it. So more work on the back end for those warnings and those thresholds. But we're past that phase, so now we are going to take a look at what will be coming up next for you all, which is going to be the MAC calculation. And there's 6 steps that we go through to calculate your quarterly claim. Step 1 is going to be what you all just did, creating that cost base for us by entering the salaries, benefits, and contracted costs for all your members on the staff pool list for the quarter. Again, you can only enter costs in for those members on the staff pool list, and all costs should always tie back to them. But once you enter those in, you can then also add in travel and training expenses for the quarter. These can be reported on your quarterly cost report every single quarter that they happen. But it's important to note that the cash basis accounting method also ties in to these travel and training expenses, as they should be tied to the quarter in which you paid for those travel and trainings for a member on your staff pool list. And again, those will be items that tie directly to a member on your staff pool list going to a training that is tied to their role in the program, their job category, and is in the quarter in question for when you're reporting the cost. So just a couple of things to note for those travel and training expenses. And on the quarterly report, these are going to be tied directly to a training or professional development that is approved. So if you have any questions on these, reach out to us. There is different travel expenses that you can report on your annual report. We have seen that question and we do have it answered on an FAQ document we'll be sending out later, but there is a differentiation between our quarterly other costs and our annual other costs. So just to make note of that in case there's any confusion around it. But we will then add step 1 and step 2 together. Those are all the costs you report to us, and that's all we need done from you for the claim to get started. We'll then take the quarterly average statewide allowable MAC RMTS percentage and reduce the claim by that. And what that step 3 is all the responses we got from every member that was sampled for the quarter, roll those up for the entire state, and that is going to be our RMTS percentage we use. So step 3 will be a statewide rate. We then will use step 4 and apply your Medicaid enrollment rate. That'll be decided based on the October 1 counts that you provided to all of us. And that will be district specific. So step 3, statewide, step 4, district specific, and then step 5 is also going to be district specific. We'll add the unrestricted indirect cost rate to your claim. This is going to be a district specific rate that comes down from the state, like Jen was talking about earlier. We add those in as a bump to your claim just for general overhead applications. So again, district specific, but that comes from the state. And then last and not least, we apply the federal financial participation percentage, which like Olga may said earlier is 50%, will always be 50%. And then once we go through steps 1 through 6, we'll get your MAC reimbursement amount. Any questions on the claim variables while we have them pulled up? And I don't see anything, but just to reiterate, steps 1 and 2 are from you at the district. Step 3 is statewide rate. Step 4 and 5 are district specific, and step 6 is going to be a statewide 50%. So just how each of those play into your role in the program. After we get that MAC reimbursement and that claim run, we'll release CPE forms to you all that will need signed again and sent back to us. So those CPE forms that we're going to be going through are similar to those best practices that Jen mentioned earlier, making sure that there's someone financially responsible as a secondary person in case your primary is out. But something slightly different with your quarterly CPE form is going to be sourcing your funds for that CPE form, the certification for public expenditure form. We do need those funds properly sourced, so through the claiming system, before you print off and sign that CPE form. Also, the claiming system won't allow you to upload and then certify your CPE form if you haven't done this funding section. We also don't want to see any written in sourcing of funds on the CPE form. If we do see that, we'll have to reach out to you again, get the fresh one printed off and then signed and re-uploaded. So just a couple things to note, but sourcing of those funds is just making sure that the total expenditures listed is all expenditures that came from state or local funds throughout the quarter, and federal funds aren't included in that amount. And once you have those funds sourced, it's going to be the same process that you all are probably used to, but just printing it off, having it signed by a financial responsible party. So typically it's going to be CEO, CFO, or a superintendent, and then uploaded back to the claiming site. But that is all for CPE forms. And again, just a new system update just for you all to keep in mind if you don't source those funds. And if the section isn't allowing you to upload that document, it is because of that lack of sourced funds.
And then Matt, we have a question from Leticia regarding the MAC calculation. So her question was, how do you calculate the MER Medicaid enrollment rate?
So the Medicaid enrollment rate is going to come from your district's October 1 count of Medicaid enrolled students. And then we take the district-wide student population that we get also from the state. So 10-1 count from you with district, statewide count for students, and then we get your Medicaid enrollment rate to be able to apply to your claim.
Can I just
Yes.
jump in on that?
Jump in.
So the 10-1 count is your district enrollment, and we get that from you. You submit that to CDE, who then works with the department, and they send PCG that file, and then we get the Medicaid enrolled students also from the department. So that's the source of those, the numerator and the denominator that are calculated to make up your ratio. that makes sense. So the enrolled students divided by your total student count.
Thanks, Rose. May have flip-flopped that while I was going through.
Yeah.
Perfect. And Leticia said that makes sense. Any other questions on our MAC calculation, any of the MAC topics we covered, or CPE forms?
Hi, I have a quick question about the CPE forms.
Yeah, of course.
Once that's ready to be completed and submitted, will we get an email?
Yes, yep. So this CPE form step is going to be separate from your entering of quarterly costs. We've seen that question recently. So this will be after we at PCG run the claim for you all. So it'll be a little bit of time. We get all those variables together. So we will notify you as soon as the claim is finished being run and those CPE forms are out for you all to be signed. And then we'll give you a window to sign them, but you'll definitely be notified. And it's not part of the uploading costs, but will be a little later on in the process.
Alrighty, thank you.
Mhm. Any other questions on MAC items? All right, I'm not seeing anything come through, but if there is anything else, we'll stay on for a few minutes. But some program contacts for us all, some resources for you all to be able to use. The School Health Services Program website is listed there, as well as the PCG claiming system. And then listed on there are a bunch of great items for you all to be able to reference, whether you're in any stage of the process for the program. So feel free to go look for all those items listed below and even more good stuff for you to be able to use. And then we also have some contact information for each of us, the department. So Olga at the department, Omar at CDE, and then ways to contact us at PCG, depending on what your questions are. But we will stay on. Have any questions on quarterly items, annual items, or anything else that we covered throughout the day, we'll be here for a few minutes to be able to answer any questions.
And thanks everyone for attending today. Like Matt said, we'll stick around just a little bit longer. These recordings will be available, as well as the presentations will be available on the website if anyone wants to go back and take a look at those. And thanks for your participation.